Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, we look into the Marburg virus outbreak in Rwanda, which has sickened 46 people and killed 12. Stephanie Desmon talks to Dr. Kari, Debbink, a virology expert at Johns Hopkins, about the origins of Marburg, a rare but deadly virus, how it's similar to and different from Ebola, and what the risk is for people around the world. Let's listen.
Kari, Debbink, thanks so much for joining me.
Thank you for having me. Happy to be here.
So today's topic is Marburg virus. And I'd just like to start right off. What is Marburg virus?
So Marburg virus, most people may not know about Marburg, but they've probably heard of Ebola. These are two very related viruses in terms of the symptoms that they cause, the mortality rates that they cause. And so you can kind of think of Marburg very interchangeably with Ebola. These are viruses that end up killing a large number of the people they infect, and it's usually through hemorrhagic fever. So what that means is basically that the virus kind of destroys the blood vessels and you end up getting bleeding from lots of different places.
So there's an outbreak going on currently in Rwanda, and I wanted to ask you a little bit about what that looks like right now and what people are concerned about.
Yeah, currently, as of October 5th, there were 46 confirmed cases. There were 12 deaths. And I think the thing that's alarming is that the majority of those are in healthcare workers. As you can imagine, if your healthcare workers are getting infected, then weakens the overall health infrastructure of the area. So I think that is a major problem. That's kind of where things lie right now. However, if you kind of look at the progress of the outbreak, you have cases, it seems to grow cases by cases, like every time they're reporting numbers. So as of right now, the cases are still going up. Hopefully, now that there's more international focus on this and attention, we'll start to see those numbers go down as there's more aid and care taken to make sure that they're identifying and containing the cases that they identify.
So I remember from Ebola, hazmat suits and goggles and boots and gloves. Is that what we should be seeing currently in Rwanda?
Yeah, so Ebola virus and Marburg virus are both pathogens that are typically worked at under the highest secure biosecurity level that there is. And so, protective gear is really important and, if it's at all available. So yes, you would be seeing the highest level of protective gear that an area has available in working with cases of Marburg.
You're saying healthcare workers are among those who are dead. I mean, hospitals must be on high alert and healthcare facilities knowing that anybody could come in with this virus.
Yeah, and I think, a lot of times what happens is the cases of something like Marburg or Ebola, they tend to first happen in more rural areas because that is where the contact with an infected animal would occur. And then they tend to spread from person to person from that original contact. So what happens is people will come into a hospital and people won't, the hospital workers don't know that it's a Marburg case. And beginning few days of a Marburg case, it can mimic other types of infectious diseases. So often it's not known that it's, something as serious as Marburg until, it's already been allowed to infect healthcare workers. Now that it's a known outbreak, certainly people are taking higher precautions with anyone that comes in with symptoms that are consistent with a Marburg infection.
Ebola spread widely in the last decade and during the epidemic. And I'm wondering if there are concerns this could become another Ebola.
I think that there's always concern that a virus can spread. I do think that in this case, the cases were confirmed before it really had spread to multiple areas. I think, the biggest Ebola outbreak that we had, back in 2014-ish, a lot of that was because it spread so far before it was really known what it was. And so there was multiple countries involved at that point and, just a really hard time containing cases. In this case, I think, so far it's really been restricted to Rwanda. And then I think maybe a travel related case or two that's been identified really quickly. So, at this point, I think it's pretty low risk for it to spread as widely as that Ebola outbreak in 2014, but there's always possibilities that somebody's missing something. But, I think that they will contain it pretty quickly, and hopefully we won't see cases outside of the areas that it currently is.
We're also seeing a lot of testing for Marburg. And I am curious, is that because we know more about it than we ever have, or because it's happening closer to population centers? Obviously, you have to understand the problem before you can attack it. And so I guess I'm wondering if this is a new development, if this is a good development, and what else we might see.
Yeah, I think that we, for a lot of diseases now, we have more testing available than we ever have in the past. For Marburg, you can do PCR testing, which is really the best way to confirm that you actually have the specific virus, and that's available probably in most major cities. And then there's other tests you can look at the blood and look for viral proteins. You can look for antibodies, those kinds of tests. So yeah, I think the testing infrastructure is better than it has been in the past, both for Marburg and for other pathogens as well.
I read somewhere that this is already one of the largest Marburg outbreaks we've seen. That's a little scary to hear.
Yeah, it is. The biggest Marburg outbreak was in Angola, and that was about 250 people got infected at that point. So that was the biggest outbreak we had. So in terms of thinking about sizes of outbreaks of infectious disease, Marburg is pretty low. However, that's still 46 people that have an awful disease at this point. And so it's not to minimize it, but just to say that it's still, not to the scope that we've seen some of the Ebola outbreaks in the past.
Now, my understanding is there's no approved vaccine for Marburg, but at the same time, I've heard that there's an experimental vaccine that is being sent to Rwanda. Can you tell us about that?
Yeah, so there is a vaccine that is not licensed. I think I'll go into a little bit about why there probably isn't an approved vaccine at this point. But yeah, so there's the Sabin Vaccine Institute sent about 700 doses of this experimental vaccine to Rwanda, and it's going to be used primarily in healthcare workers to protect the healthcare workers, and then hopefully that prevents spread to other people as well. It's a vaccine that is basically based on using the Marburg, what we call glycoprotein, so the part that sticks to your cells and helps it enter the cells. Basically, they took that piece from Marburg and they put it into a different virus background. And then that is what the vaccine is, so that your body generates antibodies against the part that allows the virus to infect. It's actually already been tested for safety in Uganda and Kenya. Those are two countries where we've previously seen Marburg outbreaks. And so there was kind of first line testing just to make sure that the vaccine was safe and it wasn't causing major side effects. So now they feel safe sending it to Rwanda, to these healthcare workers, to see if they can get data on how well it protects against Marburg. Because a lot of these rare diseases where you have these smaller outbreaks and then the virus goes away for a while, it's hard to actually do the testing necessary to show protection. So really the way to do that is to vaccinate people during an outbreak of the disease and just see, for those that are vaccinated, were they protected or not. So this is a way both to protect the healthcare workers there and to hopefully get a vaccine one step closer to being able to be licensed.
It's really hard to test the effectiveness of a vaccine when you can't give somebody a challenge vaccine. You can't say, here, I'm going to give you the vaccine and then I'm going to give you Marburg because it's so dangerous.
Well, and that's what we saw with the Ebola vaccine during that 2014 outbreak, is that prior to that, there really wasn't good enough data on how well it protected. And so what they did then is they basically did what they call ring vaccination, where anybody that they thought was high risk or in contact with somebody with Ebola, they vaccinated those people. And then they looked to see, over the course of the outbreak, how many people got it and how many people didn't, were they vaccinated, unvaccinated. And then so they were able to basically estimate an effectiveness based on how well the people that were vaccinated were protected. And that was very successful for Ebola. So I think in this case, they're focusing on vaccinating the healthcare workers first, but hopefully this, especially if they're not able to contain this outbreak, there'll be more vaccines that are given to a wider number of people.
I mean, it's fascinating, though, when you sit down and think about it, how hard it is to test these vaccines.
And there's a lot of experimental vaccines for a wide range of pretty rare diseases, but there just isn't the data to really show effectiveness and show safety in a wide number of people. And so it takes, disease outbreak before you can really get some of that data, unfortunately.
Has Marburg been around a long time?
So we don't know how long it's been around necessarily, but the first cases were actually identified in Germany and the former Yugoslavia in 1967. And this was actually in labs. So there were monkeys that were imported from Uganda to use in research. And so in the course of using those monkeys for research, basically some people got infected with Marburg, and that was how it was identified. And so we don't know how long it's been circulating in populations in some of the countries where it's endemic, but that was the first time that it was actually characterized.
It feels like we're hearing about more and more of these zoonotic diseases, the diseases that spread from animals to humans and probably back again. Why is this?
There's a couple reasons, right? So first of all, we live in a much more global society than we ever did. There's more information exchange, between everybody all over the world, right? You have the internet, even in rural areas, you may have some, level of contact to more developed places. And so I guess there's just more information exchange, but there's also more travel. So it used to be that you didn't really come into contact with people that lived in a rural area of a Central or East African or West African country. But now, people travel all over the world, live all over the world, have family all over the world. And so there's just so much more travel. So I think some of these issues that people in the United States never used to think about because it didn't ever affect us, I think, it makes it a lot more real that things could come here. Not that it was never important before, but we just hear about it a lot more because people think that it could impact us in some way. I also think that there is, more contact maybe with animals. We're more into their habitats and, developing cities, and that contact just kind of happens more, I think, than it used to. With the case of Marburg, it's a virus that's transmitted, by this fruit bat, this Egyptian fruit bat. And, it has a specific range. And, most people aren't out in caves in a lot of these countries, going and interacting with a fruit bat. But there are people that do have a livelihood, of mining and things like that, where they are exposed to these bats or the feces, the urine, maybe the saliva of the bats, or the bats come out and they feed on fruit that humans eat. And those have deposits of urine or saliva or feces on them. And so there is that contact that is happening. And when you have more travel, when you have more interaction between rural areas and then more populated areas, there's a greater chance that you're going to get these diseases that were once isolated to small areas to spread to more population centers.
Kari, Debbink, thank you so much for joining me.
You're welcome. It was great. Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.